Hi, I'm Dr. David Alter, the creator of My Heart Fitness. Congratulations on completing the My Heart Fitness cardiovascular risk assessment. You will have been given two numbers. One is your estimated or predicted 10-year risk of heart attack, stroke, or premature death. Generally, if that 10-year risk is under 10%, we call that low risk. If it's between 10 and 20%, we call that intermediate risk. And if you're over 20%, we call that high risk. And these are important numbers to help guide us. And while they may not be 100% accurate, because questionnaires are not 100% accurate, they provide a useful starting point to have conversation. The second is a graph in which we have estimated your 1-year survival rate as compared to the general population of Canada. And if your curve, which is in red, lies below the blue curve, which is the Canadian average, you are at higher risk than that of Canadian average, according to the various age groups on that horizontal line below. Why am I talking about this and why is this important? Well, I kind of alluded to it already. It's a really important starting point. And I want to actually begin by talking about a plaque, an artery blockage in the heart. And I'm going to bring this video in to help illustrate what it is we're trying to do with prevention and lifestyle change. Now, here is a plaque. You'll see it's yellow. You'll see that it's filled with fat, calcium. This is the aging spot. This is the hardening of the artery. And we may have several or hundreds of these plaques, and they could even be very microscopic. We may not even know we have them. They can be small, they can be bigger. We don't even know often that we have these. But if we looked at enough arteries over the age of 80, the vast majority will have some degree of blockage. So one myth that patients will always ask me about is, well, how do I know if I have blockages? Well, the answer to that is, if you are aging, you're likely to develop blockages in your lifetime. That is just a fact. And the objective is not to prevent these blockages from happening, because we have no remedy of preventing our aging. We can delay them. We can delay these blockages, but we can't prevent them in its entirety for the majority of the population. But what it is that we can do is to prevent the complications of these plaques. And I'm going to show you with this video how a heart attack happens. So as we run this video, you can see suddenly, wow, look at that, a sudden explosion of a plaque. It's almost like a mountain and a volcanic eruption that sometimes, for whatever reason, it becomes suddenly active and erupts. And I use the volcanic mountain eruption a lot, also when I talk about it with patients. And I look at what's in the plaque is almost like molten lava, and for whatever reason, suddenly bang, and explodes. Our bodies attempt to heal that injury from that rupture takes on the form of a clot. Just like if we scratch our skin, we may get a clot. Well, this clot heals and attempts to heal that rupture. But in doing so, the clot actually builds up and inadvertently will actually clog the vessel itself and stop blood flow from going through. And that is a heart attack. A heart attack is a clot that we form to heal a sudden volcanic eruption in our arteries from aging blockages. The myth is that we can actually prevent aging blockages. Well, we can delay them, but we may not be able to prevent them. But what we can prevent, and this is the critical piece of information, is a sudden eruption. We can prevent the plaque rupture. And how do we do that? Through everything we are going to talk about in this program. Exercise in the minutes, meal planning, portion sizes, Mediterranean diets, appropriate planned behavior, and smoking cessation, risk factor management. All of these things are really important in reducing that risk of plaque rupture. And the impact of these interventions and these things that we can do could not be understated. The scientific evidence has shown that as much as 80% of plaque rupture, heart attack, stroke, premature death, can be prevented by all of these activities. And they probably work through reducing the activity of that molten lava, of that inflammation inside that plaque. So that is what My Heart Fitness is. And I've talked way too much. I can't stop talking about risk and how to reduce our risk. It's a forever passion of mine. And that's really why I created the program. So I'll stop talking, jump on board with us, and welcome to our community. Welcome to My Heart Fitness. Until next time, I'm Dr. David Alter. Stay safe and healthy. Thank you.